be plastic cord that is put into the needle. It has two functions. First function, not to allow tissues to feel the lumen of the needle while pricking. Second one is to prevent cerebrospinal fluid leak out when we reach subarachnoid space. Understand? Mandrene. M-A-N-D-R-E-N-E. Mandrene. It is inserted, it is put into the needle, so that needle lumen is filled by this mandrene. So we put mandrene into the needle, we find this point and prick tissues. Prick tissues until we reach the subarachnoid space. Why subarachnoid space? To take cerebrospinal fluid. Actually, the lumbar puncture is performed for a few purposes. Yeah? It could be taking subarachnoid fluid for analysis. It could be to reach subarachnoid space to inject some drug, some solution, or for diagnostic purpose, just to measure the subarachnoid pressure. How we know that we reach the subarachnoid space? Also, there are a few signs. The first sign, pricking all these tissues while reaching the arachnoid, while reaching subarachnoid space. We could feel twice falling, twice. First time when we prick the ligamentum flavum. The ligamentum flavum is, actually this is the strongest ligament in our body, between the lamina of the vertebrae. Deeper to ligamentum flavum is epidural space that is filled with fatty tissue and venous plexuses. And it's clear that these tissues are soft tissues. Ligament is a dense tissue. Before ligamentum flavum, we have interspinous ligament, and superficially to this ligament, we have supraspinous ligament. All these tissues are dense tissues. So, pricking all these tissues, we feel resistance, yeah, we feel it. But as soon as we reach the inner surface of ligamentum flavum and reach epidural space, we feel falling. This feeling, yeah, occurs first. What is next layer we meet? Dura mater. When we reach dura mater, we again feel resistance, but it will be not so strong as for ligament, because it's not so dense tissue as ligament. Pricking dura mater, we feel second falling. And this feeling could be, it's definitely not so clear, not so strong as the first one. Sometimes even doctors could fail this. As soon as we prick dura mater, next layer should be subdural space. That's why we feel this falling in. And next layer is arachnoid. Pricking arachnoid is not felt at all. That's why as soon as we prick dura mater, what we do then? We push needle 3 millimeters and take out mandrene. Check. Did we already reach? Have we already reached the subarachnoid or no? Take out mandrene. There is no cerebrospinal fluid. You put it back. Push further 3 millimeters. Again, check. No subarachnoid, no cerebrospinal fluid. Put it back further. Take it out, and we see that the cerebrospinal fluid drops out. That's all. The procedure is done. After that, we do according to our purpose what we need to take cerebrospinal fluid or to put drugs or inject drugs and so on. By the way, I forgot about the patient's position. Of course, you also should tell what should be patient's position.
Sitting, flexing.
Yes, in lumbar puncture, patient should sit with the flexed trunk. Why it is done? Why trunk should be flexed? To increase the spaces between spinal processes. It makes procedure easier. Understand? There is another way. Also, it depends on our purpose indication. Patient also could be put in lying position on side. If patient lies on side, then knees should be flexed to the abdomen and the trunk should be flexed. The head should be close to the to chest, like this. Okay. For paranephral blockage, patient's position. Patient should lie on sound side. On sound side. If we do on right side, then patient should lie on left side. With the pillow under lumbar region. Pillow. Why we put a pillow on the lumbar region? To make this space between iliac crest and 12-3 wider. Because if we do not put this pillow, then this space will be very narrow and the topography changes. Understand? That's why we put a pillow. Besides this, we ask patient to flex his thigh on sound side. On sound side. Right. If we do it on right side, then the patient lies on left side, and we ask the left thigh to flex and to keep straight the right thigh. Okay? This is patient's position. Wanted to ask the second position of the about lumbar puncture signs. First, as I said, 2 fallings. We have to feel these 2 fallings. The second one, we get the cerebrospinal fluid. Demonstrate technique of pelvic nerves blockade by Shkolnikov-Silliman. The patient's position should be lying on back.